Welcome back. I'm here with Kate Dickson. She's on the board of directors with CSIH. Thanks so much for joining me today.
Great pleasure.
Can you talk to me about some of the lessons that we can learn from recent and past crises in a way to help build stronger health systems?
Yes. Let's consider Haiti as a leading example in the hemisphere of the Americas. Cholera struck in October of 2010 and took the government of Haiti and by great surprise, as there had been no history of cholera in Haiti over the past century. The system needed to respond quickly, rapidly and efficiently. And as a result, over time, there was a recognition that a very good surveillance system across the country is required to be able to reach out to the communities and to detect cases and to report up through the district level and up to the national level as quickly as possible so that the health system is able to respond. The capacity building of the human resources, the health human resources, in terms of how to respond to cholera cases, required immediate attention to strengthen their capacity. Secondly, the governance issues of decision making, reporting, and policies that can attain greater sustainability of the system was also a major point. And thirdly, the introduction of water and sanitation as being a way to prevent the spread of cholera was a key, has been and remains a key issue in eliminating cholera from the island of Hispaniola.
So you definitely talked about the actions there that need to be taken. Are there any other ones that you would like to add in terms of using this crisis in Haiti and how it can apply to other areas and other countries?
So what we've learnt too is that immunization is now a possibility to be able to protect the vulnerable population groups for the short term, while longer term investments in water and sanitation are introduced. Immunization protects an individual from between 24 to 24 months, so that's important. The other area that is very important is health promotion, health prevention messages. Behavior change is that the population understand how cholera is transmitted and what behaviors are needed to prevent further transmission amongst themselves.
How do you think that we get the right balance between the humanitarian aid and the emergency services when there is this kind of crisis, and then long-term system strengthening?
Yes, that is a challenge that we are all facing. Organizations such as the Canadian Red Cross that has the short-term responses, but also needs to look at the transition period into longer-term health system strengthening. Basically, what we have learnt once again in Haiti is that in terms of capacity building and strengthening of the human resources within the health system, that we need short-term crisis response teams that are able and trained to move rapidly within 24 hours to a crisis center where cholera has erupted, to be able to spread the word about curative care, as well as to do some early water interventions at the same time. So this is, again, one aspect of longer-term vision with short-term response capacity.
Well, thank you so much.
Thank you very much.